Okay, so I'm going to talk about posture, having good posture while sitting, while standing, and then also maintaining good mechanics while squatting and lifting. Posture is important to have because it takes stress off of the joints. It prevents that creep factor of soft tissue or just any malalignment of joints happening over time while we sit in bad posture for long periods. Um, and also, just in terms of mechanical efficiency of our muscles, it just when we have a good posture, we're working our muscles a lot less. So that's important too. So I'm just going to kind of go through the different kind of educational standpoints here. So for sitting, I just want you to put yourself in a position where how you normally sit. So. All right, and for the most part, that looks fine. One thing I want to look for is in terms of just the level of the floor with the chair. I want to see their thighs kind of parallel with the ground. We don't want the knees to go too high because then we're causing rounding at the spine. And if they're too low, we're kind of not just in a good position. We want to basically have these knees at level with the pelvis. So one thing I would recommend here is that she probably has something underneath her feet, so that causes the knees to kind of rise up a little bit, and that kind of puts the spine in a better position. Also, some people will tend to round at the back here. They tend to have a rounded posture and forward head lean. So you'll run into this a lot with patients because nowadays with technology the way it is, we're always sitting down at computers and we just kind of put ourselves in that position. So if I ever see a position or a patient who is in this position, I'll kind of prompt them to flatten their back, kind of bring their shoulders back a little bit more, just like that. And that kind of already allows the head to go from that forward lean back into a normal position. And also if they still have trouble with that, I can maybe put my fingers up here and tell them to draw their chin away from my fingers. So that kind of helps with that as well. But basically, when we put ourselves in this position, we create what's called a lordosis in our spine. And that's important to have. A lot of times the reason why we can't achieve this is because we don't have a good support in that curve. So we just kind of slouch, flatten that curve out, and we have a problem. So another nice thing to put behind your back is just called a lumbar pad. And that kind of can help maintain that natural curve of the spine and basically make overall sitting posture better. But that's kind of the idea of sitting posture. So with standing, I'll have you go ahead and stand up. So when observing standing, I'll have you just face sideways. It's always better to observe standing from the side. You kind of go off of landmarks as a therapist. You can look at the ears, the AC joint, the greater trochanter, and just basically behind the kneecap and the ankle bone, the lateral malleolus. So as I'm looking, I kind of want to see all those line up, which for the most part, it looks pretty good. So usually when people have problems, first thing you can look at is just kind of the ankles and knees. But with the knees, sometimes people want to hyperextend the knees. We want to have a little bit of a slight bend in our knees. We don't want to be flexed, we want to be extended but not locked out. So that's one thing I'll try to look for with patients, but also just again maintaining that good lordosis in the spine, but just keeping the shoulders back so they're more lined up over the ears. And if they ever have a forward head leaning posture, we just kind of tell them to draw that chin back. So everything looks pretty good. The ear is lining up with the AC joint, and you look down and you find the greater trochanter. Usually those are all in a straight line, and you want to see that line continue down just behind the kneecap. So it looks pretty good, and then it ends up, that line to me kind of looks like it ends up in front of the lateral malleolus, which is good. So that's kind of what you want to look for when you're observing standing posture, and if you see any malalignments of that, you just kind of cue your patient to get out of those. So the last thing we want to talk about is just squatting and bending lifting mechanics. So what I like to do, first I'll have you stand out of the way here so I can get in the picture, but I use this pole here. This is a good thing, like using a dowel you ever have a patient that's having a hard time with just the actual act of squatting, this is good to use. So you just kind of hold it like so, and you want it flat against your back and your bottom. And you just kind of use it while you go down. You want to focus on keeping that dowel flat to your back. So you don't want to see this happen. See how that pull's leaving my back? You want to just try to keep everything flat against that pole. So I'll have my patient try to do that. And this is just basically going to prevent what most people like to do. And what most people like to do is they don't use their legs much at all. They just bend at the torso. So go ahead and feel what happens when you just bend at your waist. You feel, well, go ahead and hold on to this still. But as you bend forward, you're going to feel that pull kind of leave your bottom, which of course is not good. So basically that's just kind of a good way to kind of key your patient to maintain good mechanics there. But now you can go ahead and take the pole away and go ahead and just give that a try, just in terms of squatting down. So you're using basically your legs, thinking about doing that. So now if I put an object in front of you, we want to work on lifting. So some of the things with lifting is, for one, you want to make sure you can get as close to the load as you can. Maintain a wide base support. So I'll just put it down here. Widen up your stance. So you want to be at least shoulder width apart, maybe even a little bit wider depending on how big the object is that you're picking up. Try to get as close to it as possible, and then just maintain everything that we learned with squatting. And when you come up to lift, think about lifting through your legs, not so much your back. And that looks pretty good. So a lot of things you'll see patients do is they like to do this. They don't lift with their legs. They're just coming to bend over like that and picking up the load. Obviously, that's a big problem. We're putting all that stress into our back. So that was a really good demonstration by Beth, keeping that nice straight spine coming down, using her legs a lot more, keeping good distance from the object, and just picking up, kind of using more of the legs. So those are kind of the three ideas with good posture in terms of sitting, standing, and bending and lifting. So, yep.